Hello and welcome back to GP Video Podcast by Nadia. So if you remember, yesterday we started talking about another very common presentation to general practice, which is called dizziness. And we decided yesterday that dizziness is a common presentation in general practice. However, the symptoms of dizziness represent a spectrum of pathology from benign to serious. And then, because dizziness is a very vast term, it actually can mean four things. So what we did was we did categorize the conditions that cause a sensation of dizziness into four categories. So number one category was vertigo. So we said that what is the definition of vertigo? Vertigo means a spinning sensation. So in vertigo, either the patient thinks that his body is moving or spinning, or the surrounding environment is spinning. So that is called vertigo, and vertigo is one of the conditions causing a symptom or a feeling of dizziness. Okay. Number two is presyncope, which is a fainting sensation. Number three is disequilibrium, which is imbalanced sensation, and lightheadedness, which means sensation of disconnection from the environment. So dizziness can be any one of these four things. Again, vertigo, presyncope, lightheadedness, or disequilibrium. Now, when we talk about vertigo, so now we have to talk about all of these causes one by one, so we can get to know that what is. Now again, dizziness is a symptom. These are the four conditions that can cause dizziness. Now, each one of these conditions can have different reasons. So we have to dig deep into it, that when a patient presents to a GP with the sensation of dizziness, how do we work him or her out? So as the Australian family physician article that we started discussing last night said, dizziness is a common presentation that accounts for about 5% of primary care visits. When a patient describes dizziness, it can reflect one of four conditions. Unfortunately, patients tend to use the term dizziness loosely. So then what we have to do, that we have to differentiate what is what. Now, when we talk about vertigo or spinning sensation, in which I said that either the patient thinks that his body is spinning or he thinks that the surrounding is spinning. So it can actually have two kinds of causes. Either the causes are in the brain, which are called the central causes, or the causes are outer ones in the ears or in the structures in the face, and that is called the peripheral causes. So let's dig a bit deeper into vertigo, okay? But before I dip down and talk about this vertigo more, I would actually like to just touch upon the other ones as well, and then we will dig deep into vertigo. Now, presyncope. Presyncope is a fainting sensation, and this can actually be really, it can be because of the serious causes. So what are the causes? Causes are either it is volume depletion, or it is neural syncope, which is anything related to the nervous system, or cardiac syncope, which is anything related to heart disease. So heart diseases, brain diseases, and then volume depletion, and there are some other causes of it as well. Like there is something called vasovagal syncope, which is not too much to be worried about. Then there is this volume depletion, which a person, either has had a very bad diarrhea and lost a lot of fluid, or has lost a lot of blood, or has been dehydrated, this kind of situation. But the two most important organs that we really need to talk about in the case of syncope is neural syncope, neurogenic syncope, and cardiac syncope. So heart and brain are very, very important when we talk about syncope. But then there is something called vasovagal syncope, which is not that, which is important, but not that much to be worried about. And then there is anything causing dehydration, and that causing a presyncope. So presyncope is again different from syncope. Syncope means fainting, passing out, and then regaining consciousness as well very soon. But presyncope, which is one of the causes of causing dizziness, that is presyncope, like before syncope. You are feeling like you'll faint, but you won't faint. So that causes dizziness, and that is one of the four causes of dizziness. Then we have got disequilibrium or imbalanced sensation. So basically what it does is it is because of the gait disorder, and again it is because of any diseases relating to the central and peripheral nervous system. So myelopathy, peripheral neuropathy, Parkinson's disease. Okay. Then we come on to lightheadedness, which is sensation of disconnection from the environment, and that usually is because of a psychological disorder, anxiety, depression. Okay. So again, going back to the number one cause, which was the vertigo. So when we talk about vertigo, as I said that, vertigo can be either because of the peripheral causes, usually ears, and cerebral causes or brain causes. Okay, so central causes and peripheral causes. So this one says that dizziness is a common yet imprecise symptom. It is traditionally divided into 4 categories based on the patient's history: vertigo, presyncope, disequilibrium, and lightheadedness. However, the distinction between these symptoms is now of limited clinical usefulness because it becomes hard to distinguish between all of them. Patients have difficulty describing the quality of their symptoms but can more consistently identify the timing and triggers. Episodic vertigo triggered by head motion may be due to benign paroxysmal positional vertigo. Vertigo with unilateral hearing loss suggests mania disease. And then it talks about the other causes of vertigo. But I would like to basically, what happens is when we talk about vertigo, we actually, as I said, we divide it into peripheral causes and central causes. Then in central causes, number 1 is vestibular migraine, cerebrovascular disease, cerebellopontine angle, and posterior fossa meningiomas, which can be a meningioma is a kind of a tumor, and that can be dangerous. So these are the central causes, while the peripheral causes, the most common is benign paroxysmal positional vertigo, which is BPPV, but we'll talk about it more in detail later. Then there is vestibular neuritis, Meniere's disease, and autosclerosis. So usually all the causes, peripheral causes, are related to ears, not the other facial structures as such, but the ears. So you can think that vertigo is either brain or ears. Peripheral is ears and central is brain. So we have to find out what is what and then treat accordingly. Then again, when we talk about presyncope, because it is because of reduced cerebral perfusion, reduced perfusion to brain, again, as I said, we have to see whether it is because of any brain cause, heart cause, or because of volume depletion or dehydration, or then vasovagal syncope, which we will talk about in detail. Then disequilibrium is a gait disorder, again peripheral or central nervous disorders. And lightheadedness is basically psychological anxiety, depression. Now, as the article said, it is very difficult to differentiate between all these 4 causes of dizziness based on patient's history, because patient's history can be a bit vague, as of course you won't remember everything, but exploring history thoroughly, examination thoroughly, then a GP would be able to differentiate, okay, which category of this is this dizziness belongs to, and then how to treat it. So we'll dig more deeper into it next time. But for now, we all remember that there are 4 categories: vertigo, spinning sensation of the body, spinning sensation of the environment; presyncope or fainting sensation; disequilibrium, imbalanced sensation; and lightheadedness. Okay, so vertigo could be because of the ears or because of the brain. Presyncope could be because of the heart, because of the brain, because of volume depletion or dehydration, or vasovagal syncope. Disequilibrium is again brain or peripheral nervous system, brain, spinal cord, and peripheral nervous system. And lightheadedness is anxiety or depression. We'll talk about it more in detail next time.